Hello, my name is A.B. Mendelsohn, and I'm an assistant professor here at the UCLA David Geffen School of Medicine, specifically at the UCLA Voice Center for Medicine and the Arts. I'm here today to discuss the care of the transgender voice, specifically the care of feminization. Before we get going, I'd like to let you know that you should send any comments or questions to us on Twitter using the hashtag UCLAMDchat, or please comment on Facebook. All right, with that, let's get going. Let's discuss the impact of voice on gender identification. Voice, as we can imagine, is a major determinant for achieving gender health. Male to female transgender individuals are much more likely to pursue treatment for their voice than male to female individuals. This is really due to the masculine vocal effects of hormone therapy that are generally not seen with feminization when we talk about things like testosterone having more of an impact on the vocal cords than the hormone effects of the feminization process. So therefore, our talk today will discuss specifically the vocal adjustments for the male to female individual. While pitch of the voice is thought to be the only consideration for feminine speech, there are a number of other factors that we really need to consider and work on as we discuss achieving gender health. These are things like resonance, where the voice echoes throughout the chest and the head. Speak frequency achieves a level of emotional communication. Things like intonation, where we're going to stress our words, and really even the word choices themselves all help to communicate to our listeners exactly who is speaking and what's trying to be discussed. So therefore, to discuss both pitch and to really address pitch and non-pitch issues of voice and speech aspects, all transgender patients really need to begin their treatment with a voice therapy with an experienced speech-language pathologist. And here's a picture of a potential voice therapy session. This is usually a very enlightening and enjoyable process, which can offer improvements across the board, again, with all of these aspects in addition to pitch. And in many cases, that's really enough and really sufficient to achieve the goals that we're looking for. But in some cases, it's really just not enough. In that case, when we really haven't achieved our goals through voice therapy, that's when we turn to surgery. And so what are the goals for surgery or vocal cord surgery, phonosurgery? And that's to achieve gender health by increasing pitch, which again cannot be achieved through voice therapy. And this is really, again, a small slice of the overall pie of the goals that we're trying to achieve. Just the pitch is something that we can focus on surgery, again, as opposed to many of the other behavioral aspects of speech and communication. But moreover, the role that I feel that we play and the entire gender health team plays here is important to provide a safe environment for the care of a substantially discriminated and an at-need patient population. And let's talk about some of the specifics. Really, about a quarter of the transgender population has lost their job because of their gender. At least half transgender population has experienced some form of harassment at their job because of their gender. And transgender people are more likely to, 9 times more likely to commit suicide than the general population. This means that whatever the social or political views on this issue, this is not a touchy subject. This is helping people. This is saving lives. This is something we all need to take very seriously. And this is something that we do. So let's come back to the voice. Where are we trying to achieve in our pitch and why? And so let's think about perhaps speaking on the phone. When you pick up the phone, you can many times tell the difference between, let's say, a low-pitched female versus a high-pitched male. But again, pitch is going to be one of the major things that our ears try to pick up. And so a study is looked at just looking at how do listeners grade a gender or assess a gender based on the overall frequency. And down here is going to be the frequency of the voice, the pitch of the voice. And as we come across this graph, we're going to be increasing the pitch of the voice as the listeners hear it. And this is the likelihood of the listeners grading that voice or assessing that voice as a male voice. And we can see, obviously, as we go up in pitch. As the pitch increases, the likelihood of that listener assessing that voice of male is going to decrease. So we do know that there's an interplay, but again, we see that's not 100%. Just increasing the voice alone is not going to be enough to change the way that we assess gender. But again, that's where we're gonna concentrate on. So let's go even deeper before we start talking about perhaps some of the things that we might do to or for the voice to achieve the change in pitch. What is pitch overall? And here we're going to delve into some of the science and physics behind voice and sound. And bear with me because we're going to break it down and try to make it as non-traumatic and non-high school science as possible. But let's think about voice and the vocal cords as a musical instrument, as something like a guitar string. And a guitar string, when you pluck it and when you string it, the motion creates a vibration of that string, and that string vibrating then causes sound to be produced, and that's what we hear. Now, how often or how fast that string vibrates, that guitar string vibrates, is what we hear as pitch. And the thinner guitar strings will have a higher pitch, and the fatter guitar strings will have a lower pitch. And that really is due to the fact that the strings will be vibrating at different speeds. And so we're going to use pitch interchangeably with the scientific or the physics term of a fundamental frequency. And the fundamental frequency of a vocal cord or a guitar string is really just that vibration that has the lowest frequency for that given length of string. Again, a guitar is a different size than a violin per se. And additional frequency waves can also be created in that string. And each one can be a multiple of that original frequency or speed. And those are called harmonics. So when we think about the difference, let's say, of the sound of someone's voice as compared to ringing a bell, the voice is a much richer sound. Really what we might consider more pleasant than just striking a bell, which is a pure tone, just one tone or one frequency. So consider also things like a chord. 3 notes played together, our ear is going to pick up that pitch as the lowest note of that chord. But again, the chord comes to provide some harmonics and some richness to that. So there's a lot of complexity going on in the voice, but when we're talking about pitch, we're going to talk about what's the lowest frequency or that fundamental frequency in which gives our ears the understanding of what the voice is. And so here's where we're really going to go into the physics class here, but stay with me, okay, because this is really, really important. When we talk about the fundamental frequency, okay, that pitch that we're trying to achieve in the voice, we know that based on what we've established in physics and science, we understand that the frequency is going to be related, it's going to be associated to the length of the string or the vocal cord, related to the string, as well as the stress or the pull of that string, how tight that string is being pulled, as well as the density, basically how thick that string or vocal cord is. And so those are the 3 factors that we can perhaps change or modulate to get the effects that we're looking for. So let's talk about when we want to increase the fundamental frequency, right? We're looking to increase our pitch so perhaps the voice can better match the gender. So we're going to increase our pitch, and so how might we go about that? Well, we can consider decreasing the vocal length. You take 2 strings of the exact same material and stretch the exact same tightness, and you pluck them. The shorter string is going to have a higher pitch, and the longer string, the longer string will have a lower pitch. So if we want to increase our pitch, we decrease the vocal length. Let's talk about the stress. Think about a guitar string. When you want to increase the pitch of the guitar string, we're going to go ahead and pull it. We're going to tighten that guitar string. Again, increasing the stress or the strain on that string or vocal cord is going to increase our pitch, our frequency. And lastly is the tissue density. Again, think about the different types of string on guitar. Even if they are at the same stress or pull, the thicker or fatter strings are going to have a lower pitch. Vice versa, the thinner strings, or we can somehow make a vocal cord thinner, it's going to have a higher pitch. So all these things can be related, and we can use that to our advantage and to achieve the goals that we're looking for. Let's talk about the vocal cords. Let's leave the guitar alone, and let's focus on the voice. And obviously the instrument of the voice are the vocal cords. And this is what we're looking at, a nice illustration of the vocal cords themselves. When we look at it, and we'll do this in the office very frequently to assess the health of the vocal cords, we're going to see a structure above the vocal cords towards the front of it. This is called the epiglottis, which is like a valve which covers the voice box when we swallow. These white structures are going to be the vocal cords themselves. Ideally, it should be nice, white, and pristine, like a piano key. Through the vocal cords is the pathway to the lungs, the airway, the breathing tube. Behind it are the cartilages, which control the opening and closing of the vocal cords, and we'll see that real soon. And so ultimately, what we're going to see is this entire length here is soft and ultimately will affect a vibration. Very similar to any instrument, that vibration produces the sound, that pitch. We'll understand more as we go along how to affect that. Let's take off that covering. Let's understand what's underneath that so we can understand the mechanics and how to make this move. When we're looking from above, again, this is that same view of that illustration. When we stripped off all the covers, we see the nice muscles, and there are muscles that create tension, like a bicep along the vocal cord. There are muscles here which open and close the vocal cords, and that's coming from above. But let's look at it from the side here. And from the side, we're going to see that this would be the level of the vocal cords. This entire structure of the voice box itself can go ahead and tilt and rock back and forth. And that rocking motion, we can see in this outline, that rocking motion creates a tightening or stretching of that vocal cord. And that's what we naturally do when someone is singing scales or trying to get up there in pitch. What they're going to do unconsciously is they're going to go ahead and tilt their voice box forward, stretching their vocal cords and increasing their pitch. And so again, going back to our equation, we understand why now that works. So let's talk about a potential surgery. And this is what we think perhaps one of the more traditional approaches for surgery for the transgender voice, specifically for feminization, is a surgery called the cricothyroid approximation. This is a cartilage called the cricoid. This is a cartilage called the thyroid cartilage. And we're going to approximate, we're going to bring it closer with the use of a stitch. And closing the space, again, rocks the vocal cords, the vocal cords forward, stretching them out and resulting in an increased pitch. And again, this is exactly what we found before, specifically working on this longitudinal stress. The problem with this approach and why perhaps sometimes this is not the correct one for the care of the transgender voice is because it permanently rocks the vocal cords forward. And so now we can't, let's say, preserve that natural ability to change that voice. And so patients sometimes are stuck in a very high, almost like a falsetto voice, as opposed to having natural, we've talked about the intonation and changing the pitch. Sometimes that can be lost when you permanently change the ability that the vocal cords can then move. What are some of the other possibilities as we look to affect the changes that can't be achieved through voice therapy? And that's really, we're going to talk about the vocal fold length. We talked about this entire structure being the string or the vibration. If we somehow just shorten this and allow only this part of the vocal cord to vibrate as opposed to the entire length, then perhaps we can get that natural increase in pitch without really sacrificing any of the natural ability of the voice box. And when we look at the average length of the vibrating vocal cords for both cis females and cis males, we see that there is a natural difference, not only between the thickness from the testosterone that naturally changes between the two genders, but really also, again, the underlying mechanics and the structure of the vocal cords. We see that there's a natural shortening of the female vocal cords, and that results in a natural increased pitch or frequency. And so that's simply what we do. And so I'm going to go ahead and we're going to skip the actual nitty-gritties of the surgery, and we're going to go straight to the before and afters. And we're going to see a video of vocal cords opening and closing, specifically using the voice before and then after the surgery that we do, this endoscopic surgery to shorten the vocal cords. We're going to see how that vibrates over there on the left. And again, this is our before. This is that epiglottis we saw before. And these are our vocal cords here. This is a before surgery of a patient who is unable to achieve that pitch changes. And we see the opening, closing, the vibrating surface, the entire length of those vocal cords. We'll go ahead and see that after. And we see that surgically, we have limited the vibration to the very back part of the vocal cords, effectively changing the natural length of those vocal cords. Let's listen to the sounds here. Again, first the before and then the after, the sound, the audio here. Again, this is the same patient. Obviously, this is the same effort and the same sound, and so we're seeing just a natural change, or let's say a tightening of that pitch, raising that to a more natural sounding, what would be more appropriate for their gender. Another audio sample here. We're gonna hear some speech here, and we're going to go before the surgery and after the surgery. This is a patient who has undergone this endoscopic shortening procedure to achieve the pitch that we desired.
Donc, lorsque les jardins sont redevenus pimpants, Cédric va se promener dehors. Souvent, 3, 7 ou 9 amis lui font la joie de l'accompagner. Ils sont émus mais saucissonnent, boivent et trinquent en chœur. En été, Cédric s'enferme à double tour.
And let's go ahead and listen to her afterwards.
Lis le texte.
D'accord. Lorsque les jardins sont redevenus pimpants, Cédric va se promener dehors. Souvent, 3, 7 ou 9 amis lui font la joie de l'accompagner. Ils sont émus mais saucissonnent, boivent et trinquent en chœur. En été, Cédric s'enferme à double tour dans le petit bureau et plonge avec avidité sur ses brochures et ses plans, accumulés dans des...
And so what we've heard is that using the physics of the vocal cords, understanding where we need to go, what we like to achieve, we can really advance our care of the transgender voice. And so let's wrap up, and then we'll go ahead and open for some questions here. And in conclusions, voice is a critical aspect in achieving gender identity and health. Voice therapy by experienced speech-language pathologists is absolutely going to be the first step towards achieving appropriate voice feminization. At times when voice pitch elevation cannot be achieved through voice therapy alone, phonosurgery can be considered. And in such times, using our physiologic and our physical understanding of laryngeal mechanisms, an endoscopic glottoplasty, like the one we saw, is a reliable technique to achieve these pitch increases. And so goals are best really achieved by creating a personalized treatment plan with a multi-specialty gender health team like we have here at UCLA. And with that, I'd like to thank you for your time today, and let's go ahead and move on to some of the questions. Okay. First question, is transgender health operations covered by insurance? This is an excellent question, really a timely one. I would say as recently as just a few years ago, it really was considered a cosmetic procedure, and that was obviously unfortunate for many of the actual health issues surrounding gender patients. And so thankfully, there has been a tremendous change for the better, and now voice surgery is really considered a medically necessary procedure in many, many cases. It's hard to know exactly plan by plan, but I would say a golden rule and a good rule of thumb here is that we are now seeing a dramatic acceptance by healthcare coverage plans to cover this type not only of surgery, but really, again, voice therapy as a covered medical treatment plan to achieving health. Okay, next one. Does hormone therapy change your voice? And really what we see is absolutely. And when we talk about patients undergoing a female to male transition, specifically with the use of testosterone, this is a really nice way and really important way that we can achieve many of our pitch changes that we are desiring when we talk about the voice. This is really not seen when there is a transition from male to female with things like estrogen therapy does not have the same effects on the vocal cords. And so we want to be somewhat more guarded as to our expectations as the voice changes in hormone therapy. But again, everybody's different. There's a lot of specific individual needs regarding things like prior surgery. Performers have very different changes to the vocal cords, smokers, as well as differences in age during the time of transition. And then lastly, what I'll go ahead and, is there any risk for voice feminization techniques? And absolutely, when we talk about surgery for any type of voice condition, whether it's a polyp or nodules on a singer versus really considering voice phonosurgery for a transgender patient, we really want to consider that as a last option, because many of the changes when what we achieve through surgery are considered lasting and permanent, non-reversible. It's something that we will only want to consider once all other options are exhausted, and we absolutely make a really important a requirement to achieve our goals through non-surgery methods before we pursue surgery. Things like extended breathiness or change in overall quality or grade of the voice are things that we want to guard against and are concerned about when we talk about any of the voice surgery. Other surgeries that are sometimes considered something like a tracheal shave, which reduces the appearance of the Adam's apple, can have dramatic changes in the way the voice sounds. And so overall, absolutely there are important risks to consider before undergoing any surgery for the voice, whether it's the endoscopic glottoplasty or otherwise. Again, when done in an experienced location and institution like UCLA, as well as done with the appropriate expectations with a multi-specialty team, these risks can really be reduced to the greatest extent. Okay. And with that, what I'll do is I'll say thank you so much for your time today and joining us for our webinar. We welcome any patients here at UCLA to come and learn more about the care of the transgender voice with our Gender to Health team. And thank you again.